is Medical Prime UK, and this is Dr Theodora Kalentzi as our guest today. So we're privileged to have Dr Theodora Kalentzi as our guest today. Dr Kalentzi is a renowned menopause specialist accredited by the British Menopause Society, and her expertise spans across women's health and menopause, hormone replacement therapy, osteoporosis, testosterone treatment for women, and perimenopause. As the founder of Medical Prime UK, she brings her knowledge to the forefront of women's healthcare. Join us as we explore her insights into these critical aspects of women's well-being. Dr. Kalentzi, many thanks for your time today in discussing perimenopause.
Well, thank you very much, Coral, and this is a fantastic opportunity to talk about a subject that I'm so passionate about. As you said, I am a menopause specialist accredited by the British Menopause Society. I had this interest in women's health and particularly the menopause care for many, many years, even going back into my student days. So it goes back a long time, dare I say. And after many years in the medical profession, doing a variety of roles that I loved, from training, education, clinical, even management work, I set up Medical Prime, which is a private menopause clinic in the city of London. And that was back in 2018 when we opened the doors to our patients. And I haven't looked back since. It's been fantastic. It's an area, as I said, that I'm really, truly passionate about. And I can give 100+ % of my time, energy, care into the topic that I love. Well, I should start first of all with what is the menopause, which is the term that I believe most people nowadays are familiar with, although there's a lot of confusion still with the terminology. So the menopause is the actual stop of the periods. It's the natural, usually, end of the periods, the menstrual cycle. And I'm very proud usually to say that the menopause is a Greek word, and my listeners may have appreciated that my accent is not English 100%, but I do come from Greece, and the word means exactly that. It's the end of the menses, it's the end of the menstrual cycle. So looking into what is the perimenopause, this is now the stage before we go into the last natural period. It's a transition stage. It's the time in a woman's life where the hormones start changing, the ovaries and the function is changing, with less production and fluctuation of the different hormones, and that can be what is called the perimenopause. So it is the transition time where changes are happening, and they will lead in the end to the last natural period, which is the menopause. Now, you asked about symptoms. And again, this is very interesting because this is something that every specialist in the field keeps repeating, that the menopause and the perimenopause is very unique to every woman, and we all experience it as women in a different way. So when we talk about the perimenopause, there could be symptoms, and this can include changes in the menstrual cycle and a variety of symptoms, which include physical, emotional, cognitive, and what we call urogenital. So in a nutshell, they can be different presentations, there can be different types of symptoms that women may experience at different frequency and severity. And it doesn't have to be all of them. It can be some symptoms that a woman may experience, and this may change during this perimenopause stage, the perimenopause transition. And although we talk about menstrual changes, it doesn't have to be for every woman that they will experience the changes in the cycle. I have a lot of women who tell me, but my cycles are still regular. Can I still be in the perimenopause? And in that particular area, there's no black and white. There can be a lot of gray when we talk about symptoms and presentation of the perimenopause. And the answer is yes, it can be, even with a regular cycle. Well, again, it's very interesting looking at what is in literature. how the data keeps changing as more women come forward to talk about symptoms, to share their experiences and to seek help, and what we see in practice on a day-to-day basis. So usually a woman would expect to start going through the perimenopause in her 40s. So looking into 40s, when in the 40s, again, typically one would expect from mid-40s onwards, but in practice, I see in the clinic a lot of women who experience symptoms much earlier in their life. Definitely early 40s has become very, very common, and more we see women asking for help, asking the question, even when they are in their 30s. And occasionally, of course, we do have these situations where symptoms can start much earlier, even before the age of 20. But these are a slightly different group of, I would say, women who experience either a premature menopause, and then we may have even the women who will have the early menopause when that happens between the age of 40 to 45. Below the age of 40, then we're talking about a premature presentation. But overall, I would say 40 is usually the age that we can use as a cutoff to think about the perimenopause. Again, as we said earlier on, there can be a lot of different symptoms and there can be changes in the cycle. So usually, if I start from the latter, changes in the cycle could be a missed period. Periods may become, or cycles can become longer. Women usually experience a miss or period, or they may say, well, my cycle used to be, let's say, 28 days, and now it may be 33, 35, or sometimes I'm not quite sure when my bleed will come. Having said that, they can be the other way around. Sometimes we may see more shorter cycles happening, but usually, typically, it is the other way around with longer cycles. And of course, it's the flow of the bleeding as well that can be affected. Sometimes they can have heavier bleeds, more painful. Sometimes they can be lighter. But what is really the main area that women are getting more information nowadays, rightly so, is about the symptoms. And this can be, as I said before, different groups: physical, emotional, cognitive, and urogenital. More commonly and more popular in terms of awareness are the symptoms of the hot flashes and the night sweats. So these are predominantly linked to menopause, perimenopause, but as I said before, they are not the only ones. Emotional symptoms can be very common, particularly anxiety that can start without any obvious trigger or any changes in life or life events. There can be changes in the mood with low mood and mood swings, and they can be a range of symptoms in the spectrum, from heightened symptoms such as irritability, anxiety, and going to the other end of the spectrum, which can be feeling really low, even depressed, and sometimes being in a very, very difficult place. Some cognitive symptoms, more commonly, you might have heard the term brain fog, having this kind of cloud in the brain where you think, oh, I'm not quite sure what I was supposed to say something, I forgot a word, or I can't remember why I got into the room, or all of a sudden, this ability, dare I say, that we claim that women we have, the multitasking, can be more challenging under the perimenopause kind of influence. And then it's not to underestimate effect on what we call the urogenital. So a lot of women experience changes in the bladder. So getting up at night all of a sudden to pass urine, or feeling the urge to go during the day, which can be very, very disturbing. And a lot of women think, oh, that's because I had children or because I'm getting older, and they dismiss that as a potential early sign and symptom of the perimenopause. And then there can be some vaginal dryness, which again can have a detrimental effect on sexual contact and then can affect libido, which is another symptom that we hear a lot. There's a lot of grief in that area too. So it's a mixed kind of like bag, if I can use that term, in terms of how many symptoms, how often, how severe, and that is something, as I said before, that can be very unique to a woman, and symptoms may change over time. Some can get better, some may become worse, or they may experience other symptoms that were not there, let's say, in the early stages of the perimenopause. But overall, these will be the main, more common symptoms that a lot of women come to the clinic and they talk about. But interestingly, what we see a lot of the times is a series or a group of a lot of other complaints or presentations that they're not quite your typical symptoms you read in textbooks, but with experience you understand that how different we all are and how we may experience this change in a very unique to us way. So it's always good, whatever concerns a woman has, whatever symptoms she has experienced, to talk about them, no matter how different or strange or unusual they may sound. This is a really good question, because I believe that lifestyle is something that we should look into throughout our life. We shouldn't really wait for the perimenopause or other health changes in our life to make us think about it. But it is a good time to reflect, because it is like an early warning from our body, or it is a reminder that we are growing, or dare I say older. I wouldn't say old, because we all grow older from day 0 or 1 we come into this life. So it's a good time to look into our habits. How much do we drink in terms of alcohol? How often? Because it's interesting how a lot of women think, oh, I don't really drink during the week, but I do have at the weekend. And when you ask a little bit more about it, it may not sound very healthy what we do if we have more than the recommended 14 units, or indeed even the 14 units at the weekend is not exactly the best thing for our health, medium and long term. Of course, smoking habits, that is again a really good time to look into that for many reasons, not only the perimenopause, but also for the long-term effects, and looking into our exercise, kind of like regime or habits. Last but not least, diet is very important, and again, there is a lot to be said about healthy diet, balanced diet, because it's not only about symptom control or how diet may help us potentially with some of the symptoms that we experience in the perimenopause, but there's also this dreaded weight gain that I would say almost every woman I see at the clinic complains about that. Rightly so. It's not in their imagination. It does happen. We do change, our body changes over time, and we do see more of that in the perimenopause when somebody says, but I eat the same, or perhaps my exercise fitness is the same, and now I see more weight, particularly around this waist area. But again, looking closely into that, there can be a lot of room for change, modification, how we adapt our habits into this way that our body biologically is changing over time. Well, it's a very open question, because one would need to go through about the treatment options, and they can be very many. From the hormone replacement treatment, which is the main medical treatment that one would consider as a way to manage the perimenopausal symptoms, there are other medical treatments which are non-hormonal. So, for example, I know that a lot of women will dread hearing the word antidepressants, but it is a very common option that can be offered and considered by women for symptom management. And there are, again, as I say, a lot of other medical treatments, so they're not hormones. And the choice and how we will decide whether they are appropriate for a particular individual will depend on symptoms, on medical history, on risks and preferences of the individual. Then there is a group of non-medical treatments, and that can be complementary therapies. And of course, there is a whole kind of series and so much choice out there that women can be really confused when we go and look at the health soaps and all these fantastic menopause products that are advertised either physically or online. And again, for some of them, there is some evidence behind them to support what they claim to help with, but with others, one needs to be more cautious about what they claim to help with, because they can come with risks, they can come with side effects, they can interact with medication. So because it's supposed to be natural and you can buy it over the counter, it doesn't mean that it's 100% safe and bears no risks at all. And then, of course, there are the lifestyle kind of like approaches that we alluded a little bit earlier on. So exercise, particularly types of yoga or cardiovascular or weight training, they can help in different ways to help manage some of the physical and emotional symptoms in particular. And there can be other techniques or therapies, including acupuncture or hypnotherapy or reflexology that can help in some way with the management of symptoms. And of course, there is more and more nowadays talk about how to practice mindfulness and meditation, and looking into other approaches such as the cognitive behavioral therapy that can also have a big role with very good results on symptom management. So it really depends on which treatment options we are looking at, and sometimes it can be a combination. We're not just saying either have this or that and nothing in between. We can work together with some of the potential alternative or complementary therapies when we look into medical treatments. And then it's for the specialist role to explain and to share with women what are the main benefits of each therapy and option, what are the main risks, and what they need to be aware of when we go for one or the other, or a combination indeed of them. So we will need another session to talk about risks and benefits, but it really depends on what are the predominant symptoms, what are the priorities that a woman has, because they may be very different to mine as a medical doctor. I may see you may have 30 symptoms and I may think, oh, that's really my number one to manage. And very, very often I hear of another symptom that is the priority for the woman I have opposite me, explaining that this really, if that gets better, I'll be really, really pleased. So we need to take that into consideration and then offer what are the best approaches to that and what are the potential risks, side effects that can be linked to that approach. It's a really good question, because so many times still women may experience the symptoms in isolation. Some may feel, well, I'm too young to talk about that, or my friends don't seem to have anything like this. How can I possibly talk about the perimenopause, or indeed with the partners, particularly as some women may have delayed going into having a family or starting a new relationship. This is not exactly the topic you would start talking about with your partner, or even when you have been in a long-term relationship or you are married, and you think, oh, libido is not really as it used to be, or a lot of women tell me non-existent at all nowadays. And then how do you start explaining, how do you start talking about that in a way that your partner doesn't take it personally? Because that is the main thing, really, is when it becomes an issue for argument or resentment, or there is kind of like a concern or fear that this may affect the relationship even further. So Again, it depends really. It depends on the individual, it depends on the relationship, it depends on what else is going on in the background. And of course, we shouldn't really underestimate the effect of culture and where people come from, because it might be even more challenging for some cultures to talk about it, and others it might be very easy, very straightforward to talk about menses and symptoms and cycles and name it. So it's taken this all into consideration and really exploring with the woman some perhaps approaches of what has helped before when they had some challenging kind of issue to talk about with friends and family, and again, from our experience as medical professionals, what we have seen from our patients, from the women we work with, that it has helped them. So it's a two-way process. We learn from each other and we can share ideas. So in my clinic, we will talk about using perhaps the appointment as a good starting point. And we do use a symptom chart, which has about 35 symptoms included there, where we ask women to rate them from a scale of 0 to 5. 0 means there's no symptom at all. 5 means it's quite troublesome. It's the worst for them, whether it's severity, frequency, or both. And then it's interesting to see how many of these symptoms they have and which ones are the priority. And I encourage them to share that symptom chart with their partners or family or both, or whatever they feel more comfortable with, because that then can be an eye-opener for the loved ones to see, oh, we didn't realize you were suffering so much, or we didn't really see that you were going through all these. And that can start a discussion, that can start a dialogue. Last but not least, I encourage a lot of women to come here with either a family member or the loved one, the partner. Well, as I mentioned before, I would still signpost women to the British Menopause Society. This is the main professional body in the UK that is responsible for the training, education, and guidelines around menopause care. And I would really strongly advise women to be familiar with the website. They have also established another website which is called Women's Health Concerns, and this is designed particularly for the public, so that in a user-friendly language, some of these concepts and information is shared in a way that can be understood and hopefully not to add, but clear the confusion that one can go through when they look at all this information that is available online. The British Menopause Society also has a YouTube channel, and they are posting very regularly short and helpful videos of very common conditions, very common situations, and obviously some of the main queries that women may have about the perimenopause, menopause, and the various treatments and risks and benefits. Obviously, helpful podcasts and webinars like the ones we're doing today are highly recommended, particularly when you have specialists in the menopause care field involved, and they can share their knowledge and at the same time their expertise and experience, which is really valuable when we talk about individualized care.